pulling us closer. That's a good one. All right, we are here today with the wonderful Dr. Chinn.
Howdy.
And it is the month of Women's
February.
Heart Health.
Oh, sorry.
It is the month of February. Yes. It is also dedicated to women's heart health. So we are discussing today women's heart health.
Oh, sorry.
So there's a statistic that we wanted to share at the start of this. That is...
Oh, yeah. It's the #1 killer of women.
1 in 4 women who die of heart problems. Heart disease.
Yeah.
So why should a woman's heart health and treatment be treated any differently than man's heart health? Why are we so behind the curve? Care for our hearts.
Well, it's that's a loaded question, man.
Loaded question.
That's totally a loaded question.
Let's dive in.
Yeah, well, part of it is like being female. We're kind of like the underrepresented minority, and cardiac disease is always considered to be more like a man's problem, but actually it affects everybody. And unfortunately, as medical providers, we kind of brush that under the carpet and don't realize that, you know what, that needs to be addressed. I mean, if ticker doesn't work, then
nothing works.
Yeah, pretty much.
We're in trouble. Mayday. So with that being said, why should a woman's heart health be treated any differently than a man's?
Well, we need to prioritize heart health as, something that, we need to be on top of. We need to make sure we check your blood pressure is good, make sure that cholesterol is great, make sure you're exercising well to optimize your heart health.
Have to go pump weights and go on 80-mile runs every day?
Well, you could, but for most people, including myself, that is not going to happen.
Doesn't happen.
No. So there are other things that we can do to really help you, exercise and really kind of get the heart going. One thing that we do have is this cool machine called the M-Sculpt.
Ooh, yeah, she really dove right in.
Well, dude, I mean, if we can do something to get people exercising, so M-Sculpt basically is another high-fem technology that stands for high intensity focused electromagnet energy, that basically makes your muscles grow bigger, and it recruits more muscle growth. So I guess it's kind of a cheat way of going around it, but basically it gives you, I know,
that's a good,
I said the cheat word.
That's a good cheat.
Yeah, it is, but
because right now all I'm cheating on is the brownies and cake.
What?
No, not really. But that would be my cheat.
We need to talk about this offline, Sarah.
Don't tell Morgan. No, I'm just kidding. I'm not eating anything. But truly, that would be my idea of a cheat, right? That's not.
No, this is like a good cheat. A good cheat, yeah, definitely.
Poor connotation of the word.
Right, but I see it more like a medication, It's like blood pressure medication. This actually gets your muscles to be bigger, so then it actually increases your metabolism. It makes you exercise.
Yeah.
But
makes you want to exercise too.
In addition, so when your muscles are bigger and it's easier for you to exercise, then it's going to kind of give a sort of positive feedback loop as to exercise, and basically help your heart, helps your mental, emotional, psychological situations. Not to mention, it kind of helps the lungs, helps the immune system.
Yeah.
It just.
And it's the only machine out there that actually eliminates the fat cells.
Oh, that too. Yeah, we didn't get into that part. I'll just.
We're gonna have to do a Facebook Live on just the M-Sculpt.
Yeah, we should.
Just the M-Sculpt.
Yeah, Morgan can do that. I elect her to do that. Yeah.
I elect Morgan.
Yeah.
So I've never. Okay, sometimes I'll have a little pain, right? And I don't think anything of it. I never have the shooting pain down my arm or anything. So in my mind, I would think well, if I'm not having chest pain and there's no pain shooting down my arm, I could never, there's no problems with my heart. My heart's fine.
Oh, yeah, that's a common fallacy. So,
Word of the day.
yes, fallacy.
Yeah.
Yes. And it leads to another word that I'm thinking of right now that's probably, anyway, I digress. Yeah, actually, so women, so the typical presentation of a heart attack is chest pain, like an elephant sitting on my chest, or pain going down your left arm. Those are the traditional symptoms that people complain about for having heart attack, but that's more actually geared toward the guys. The way that they have
a difference in women's heart health versus men's.
Huge.
That's more common in men.
Yeah. So the pathophysiology of coronary artery disease is so much different for men versus women. So in guys, they usually collect cholesterol, plaques of cholesterol, or just kind of just accumulations of cholesterol and plaque. They collect it in the main arteries of the heart, and it usually has kind of like irregular groupings of fat. So when you do any radiology studies, you can see, oh geez, there's a big old clump of fat in the main coronary arteries, and when you kind of block off the main blood supply through the biggest arteries, it causes more symptoms of like that crushing chest pain. So that's why guys usually feel symptoms of, oh dude, there's an elephant on my chest. But for women, we don't have those sort of plaques. It doesn't really necessarily accumulate in the major blood vessels to the heart, and when it does, it's more of a symmetrical accumulation, so it's easier to miss that diagnosis. In women, usually you have like microvascular disease in the smaller arteries in the heart. So because of that, the presentation in women of having a heart attack is much different. You can feel fatigue, like you're feeling really, really tired. You can have indigestion symptoms. You can feel nausea. Jaw pain can happen. You can just have back pain. So very, very different presentation of heart attacks in women. So because of that, we kind of, as women, we kind of blow it off and say, oh no, we're just, there might be a lunch that's causing these symptoms. But these symptoms unfortunately get overlooked. And in the cardiac world, most places in the medical world, time is of the essence.
Yeah.
And you need to, go see the doctor and get this addressed, because it could be a heart attack.
Yeah, especially if it's consistently happening.
Yeah, most definitely. If it, I don't know. To me, it's like we're really attuned to our bodies, and if it doesn't feel right to you, go get help.
Yeah. Call.
Yeah.
360-824-5278.
Well, unless you think it's a heart attack.
Oh, then dial 911.
Yeah, 911. Yeah.
There's this, from what I've learned from both you and Morgan, there's this common misconception that only elderly folks have heart problems or heart attacks or congestive heart failure, all these things. Hi, Kristen!
Hey, Kristen!
Stay tuned! So, is it true that only older folks can have these problems and concerns?
No, not at all. In fact,
I'm only 32. I can't have this problem. I'm way too young. Riddle me this.
You're right. I mean, chances are, if you're having these symptoms in your early 30s, then chances are it's not. But it's not impossible. I think there was a study saying recently that 31% of women who were hospitalized were for cardiac problems. And there was a huge jump in heart attacks in women between the ages of 35 and I think in their 60s. Huge increase, like I forgot what the numbers were, but you can have heart attacks definitely in your mid-30s on up. So please don't feel that can't be what's going on, because if you think it's a heart attack, it needs to be addressed. And
did it say anything in this study about these women that were seen for these cardiac things that they had gone in for something else, like maybe they were having really bad indigestion, and it turned out they were having an underlying cardiac issue.
Yeah,
that seems to happen quite often for women.
Unfortunately, because being the owners of the minority, excuse me, actually, we are represented minority. It gets blown off because the stigma in not just the general population, but unfortunately in the medical community, is that you have to have the chest pain and the left arm pain in order to have a heart attack, but not so true.
Yeah. Which is, do you think sometimes why women, if they go to the ER with a concern, don't get addressed as quickly because they're not saying, I'm having chest pain?
Unfortunately.
That's a bummer.
Yeah, unfortunately.
So with all that being said, why do you think that heart disease is such a problem, specifically for women, but in general, why do you feel like it's such a
God, that's a huge can of worms.
That's a big one. Let's open it right now.
Oh, God.
Off the top.
Yeah. Well, everyone kind of, I think, has the idea, is like, oh, like, I don't have to worry about that when I'm older. And there's no real family history of heart disease, so, I'm not going to worry about my heart. But unfortunately, with people's diets nowadays being a lot unhealthy fats, lack of exercise, stress from everyday living, we abuse our bodies a lot. And I think that we can be more proactive and address those things and keep your heart healthy, so then you don't have the sequela down the road of having a heart attack, or that potentially leading to a stroke, or something bad. I want everyone to be healthy and live full lives up to your best.
Yeah. So. And if you're having any concerns,
yeah, so basically
you should call.
Routine,
360-824-5278.
Yeah, but regular screenings are really important. Making sure that your blood pressure is well controlled, making sure that you do cardiac screening, make sure that there's no cholesterol issues. Making sure that you exercise.
That's what I was just going to ask next.
Yeah,
you had mentioned the M-Sculpt and how it's really good for this kind of stuff, but what are some other kinds of exercises that women can do to kind of... Strength training, I think, is a really good thing to do. That really kind of works more of the muscles and the heart. It really gets your metabolism going. And the M-Sculpt in that matter is a great way to kickstart the strength training if you're not already strength training. Right, exactly. M-Sculpt. We do it. This message is approved by Dr. Chinn and M-Sculpt. Is there any other kinds of exercises that women who maybe aren't ready to start the strength training and who aren't there yet and are having a harder time kind of getting to that point? Is there anything that they could maybe start doing at home or around their neighborhood? Yeah, definitely. Just little things, like maybe parking your car not as close to the entrance of the supermarket, or even if you see that prime real estate right up front. Yes, maybe park a little bit. Let someone else have it. Right. Just walk, just little bits. They add up. Walking a little bit more, maybe, not watching as much television, just turning it off and doing another activity. Watching what you eat. Basically, try not to snack on junk food, and maybe putting away the sodas. Those are things that are really important. Yeah. If anyone else has a younger kid at home, the best way to get up and move is to compete with them daily on a Fitbit. But he beats me every day by like 10,000 steps. So. But it helps me move more. I'm not gonna lie. I'm trying to beat him. I'm trying to beat him. So, getting up and moving. I'm working on my heart health. I know. You guys are saving all of our heart health. Even Kristen said, "Thanks for saving my heart health." Oh, heck yeah. Yeah. Absolutely. Me too. My heart to you. Oh. I know. So sweet. We talked about younger women having heart attacks. Yes. Are there any other steps that they can take to help minimize their risk of a heart attack other than moving and eating healthier? Just decreasing your daily stress.
when you get stressed, the heart doesn't realize if it's like a psychiatric sort of stress or if it's like a physical stress, like a trauma. Any sort of stress affects the heart. So, just trying to control, and it's very difficult nowadays. But if you control your daily stressors, that is a good thing. Yeah,
I've giggled at her. You should have recess. We should get a recess.
Oh, we should. We
should get a recess. Go outside and play basketball.
Yeah.
Or something.
Or I could, ride your bike or.
Oh man.
Yeah, I know.
Well, maybe we should get up and go for a walk.
Yeah, we probably should. Especially the weather.
It's permittable today.
Yes,
is that a word? It's permitting.
It is.
So we're gonna go for a walk. We're gonna increase our heart health. We're gonna take care of ourselves. You guys need to take care of yourselves. If you're having a hard time, call 360-824-5278. Until next time, we will have Morgan here again.
Yes, Morgan. Yes.
And Kristen, you're killing me. You will have to stay tuned on our Facebook to see what we're going to talk about next week. It's going to be a good one. So, come in and see us. Call us. If you have questions about your heart health, call us, message us. Come in, schedule an appointment. Dr. Chinn would love to see you. I would love to see you. Morgan would love to see you. Lex would love to see you. Give us a call. We will see you guys next week.